So if you're talking to somebody who's interested in bringing mass spec into their lab, what helpful tips or advice would you give to them?
I think I would probably tell somebody who is starting out to start with a method that was pretty straightforward, that there might be an I method for their platform, so that they can get the hang of just the day-to-day sample prep and injection and integration and all of the things that become routine after a while, but at the beginning are confusing. And after they've done something that's pretty straightforward, then they can start being more adventurous and developing a method from scratch. Having somebody who has previous expertise in all the things that can go wrong, particularly LCN, because it's not really the MS that breaks, it's the LC. That's huge for us. And that saved us a lot of downtime.
I think the next thing you have to plan for is that you going to have to train people. And some of it is a whole culture adjustment, that people are not used to getting their hands wet. It's definitely the case, I say this to everybody who works for me, that you can have a method that works great in one lab and not in another because somebody doesn't know how to fasten the fitting. They leave a big dead volume, so you don't have the separation. So that, to me, has always been a selling point for people, that your skill as an analyst really makes a difference.
Mass spec offers an intellectual challenge that has been lost to the immunoassay market, and that's great for them.
If you're thinking about bringing this technology in, the best thing you can do is talk to people who already use it. We're all very friendly and nice and collaborative, and I feel that it's important, because they can then give you the real world experience.
What I say to people is, I think that at least doing clinical mass spec, it's kind of like learning cooking. You can read the book, but it's doing the hands-on, and the best thing is learning it from another person who knows what's happening, because all the things, there's just a lot of little picky detail that people don't necessarily tell you. And some of it is things that I've always done it this way and it worked, rather than I actually validated that was, the exact correct way to do it. But maybe that's part of what lends the flavor of it, as you say, that it's a collaborative community along those lines, because people realize that even the best laboratory, you might go in there and find they have exactly the same problems that you do.